blood clot formation, in addition to some medication. I mean, if you are taking oral contraceptive pills or hormonal replacement therapy, particularly the estrogen, can put you at high risk for
so that
thrombosis.
means that this is more indicated towards the females.
Yes, females, yes. This is very important because this disease, it's more prevalence and incidence in females. There is a very common risk factor here in our society is pregnancy and postpartum. You know, because we have high conception rate, that will lead us to a lot of pregnancy or postpartum associated blood clots. So this is one of the risk factor. Among other factor, family history. If you have family member who have history of blood clot, this is put you at high risk. There is what we call thrombophilia. Thrombophilia, this is, I mean, literally means increasing tendency to develop blood clot. It is a familial due to genetic disorder.
That's why they even named it after, like, as they say, women are from Venus. So they have associated it with Venus.
That's great. So this is the presentation of DVT. Usually I urge, you know, the viewers, my dear viewers, to present early to emergency department if they have such manifestation. The physician will decide this is a DVT or something rather than ignoring it.
So
and
if you have pain, if you have
swelling, redness, and warmth,
and
sometimes dilated veins, sudden onset dilated veins, this is in addition to the other risk factor, family history, medications you have. So this is all risk factor can increase your risk for blood clot formation. This is for the DVT or deep vein thrombosis. What about the pulmonary embolism? Usually they present sudden onset, again chest pain, shortness of breath, and the chest pain usually described as increased with taking deep breathing, pleuritic chest pain, and associated also with the hemoptysis, I mean production of bloody sputum, and dizziness, and some severe stages they can collapse, fainting, this is means a large blood clot occluding the whole pulmonary artery, and preventing blood flow to the to the heart. So this is to the lung, and usually, minority of cases they present with death. That's why we encourage people to, once they have start symptoms, they present to hospitals. It is the most preventable cause of death among hospitalized patients. The most common cause of death that can be prevented among hospitalized patients. Account for 10%. So this is just give you overview what we are talking about to differentiate from arterial blood clot like stroke, acute myocardial infarction in the arteries. We call it heart attack. This is different. This is blood clot in the venous system.
Right. Now, doctor, you mentioned that it can be, it can start from the thigh area, where it can be caused by swelling, by the vessels, by some pain there, and it can eventually lead up to some chest pain.
Definitely.
Now, there are so many women who have a leg pain. There's so many women who complain of chest pain. How is it that they're supposed to know that this is something serious and they should go and get it checked? How do we tell the difference? Because pain is pain. You cannot really tell because we are not doctors. So how do we tell the difference and actually take the matter seriously in order to be dealing with a physician about it?
Yes, thank you. This is a very important question. If it is like persistent pain, it's a pain transient just for a few hours and then disappear, it's a pain without swelling, without redness, without warmth. This could be just musculoskeletal pain. We call it muscle cramp. But if it is the pain, redness, swelling, which is persistent, and you have other, risk factor. So usually, as I mentioned, it is we take the patient as a whole. Not we, look to one symptom. And in addition, you present to hospital. The physician will decide. You should not, diagnose yourself. These are hints. For you. To present to medical care. So a physician can look, after to, this is really, because it can be other, causes for leg pain, like if you have infection of the skin and subcutaneous tissue, we call it cellulitis. It can be fracture. It can also the other cause, hematoma. If you have a trauma, you can develop hematoma. So we have to put what we call differential diagnosis, not one diagnosis. Then accordingly we narrow our diagnosis. But if it is persistent, as I mentioned, with other risk factors, they should present to hospital, okay? Like a pregnant, postpartum, okay? I mean, and oral contraceptive pills, they should not ignore, okay?
Well, so Dr. Mohammed, tell us how common is this amongst females, as you already specified that it's more observed amongst females. How common it is amongst females, and is there a particular age group? I mean, as you mentioned, contraceptive pills,
yes.
as you mentioned, the hormone replacements. So should we here consider that women who are, let's say, between 20 to actually even 50 or 55 are more likely to have it?
Yes, I mean, the lifetime risk for venous thromboembolism, let us say 1/1,000. 1/1,000, okay?
Oh, okay,
This is
1/1,000.
lifetime risk, yes. But this is a disease of aging. As you get older, the risk of a thrombosis is increased, or the risk of blood clot formation is increased. So if you have in young people, okay, so this is telling you please look for other causes like familial or genetic tendency to develop blood clot. They say over like 65, it will be 1/100. I mean the incidence,
At
okay?
the age of 65.
Yes. So this is the lifetime risk. Here in the kingdom, we don't have accurate statistics, but actually we are more or less similar to the Western world. But we have different risk factors. As I said, increased conception, okay, they have less, I mean, conception rate. In addition, we have some, this is our observation, our clinic, we have some genetic disorder that's not, okay, common in the West. Like we have protein S deficiency. This is a natural anticoagulant. This is natural protein in the blood that prevent clot formation. Right. So if you have deficiency of this, that this is the most common in our area, you will have increased tendency to develop clot
so Dr.
formation.
Mohammed, quickly tell us as to, through this particular conference, did something else come on the surface which can actually lead to the prevention of this kind of coagulation of the veins?
Yes, this is very important. Prevention is the most important. Prevention better than cure, particularly in such cases to prevent the mortality and morbidity. So usually, I mean, prevention, includes early ambulation or movement. So if once you have the surgical procedure, you have to move as soon as possible. So we have to encourage the early ambulation. Because if you are confined to the bed more than 3 days, this will cause to the slowing of blood flow. We call it stasis, will increase your risk. So this is the conventional. You have to put also what we call graduated compression stockings. It will compress the veins, okay, because the veins lack the muscles, different from arteries. So you put elastic compression stockings, it is graduated. It starts the highest compression in the calf, in the ankle, then the calf, then the thigh. In addition, you can put a pneumatic compression. It's like a pump, okay, it's a machine to pump compress in the muscle to pump the blood flow. So this is for such cases. Then we have the medications. Medications, like if a patient cannot mobilize, okay, or have many additional, blood clot formation risk factors, so we put them on medications. We call it prophylactic medication, mean preventive medications, like it is heparin. This is the most common one is heparin, and there is a new medication which have been around for the last 20 years. We call it low molecular weight heparin. This is a derivative of the old heparin, can be injected through the subcutaneous, it's under the skin. The classic medication. Now what we have in our conference, a new medications, not only for prevention and for treatment. I'm sure it is now a hot topic in the media. We call it the new anticoagulants or new blood thinners. Okay, this is the term can be used for the public. So these medications can be given orally through the mouth. I mean, this is more convenient for the patient if you choose to take injectable medication or, oral pills. In addition, they don't need monitoring. So if you receive a treatment, okay, for example, this is for prevention. I don't want to confuse the audience. For treatment, we use the most common medication is oral is warfarin.
Yeah.
Warfarin or Coumadin. This is a medication that is the most commonly used medication in the world.
Indeed.
In the world, okay. So for treatment for various blood clotting disorder.
Correct.
So this medication, which
Dr. Mohammed, very briefly here, as we're running out of time, in order to prevent this kind of, let's say, a blockage in our veins, you mentioned the medical prevention and the breakthrough methods and technology which has come
Yes.
now with the oral pills. But can constant exercising and keeping fit and a healthy lifestyle can actually prevent all of this from happening?
Definitely. I mean, therapeutic lifestyle modification, including exercise,
Yeah.
walking, I mean, weight reduction, smoking cessation. It's one of the causes for thrombosis, okay? And particularly if you have decrease in the waist, okay, circumference, we call it abdominal obesity. This is all will, okay, decrease your risk to develop blood clot. I urge my people who are traveling long distance, okay, to take, to consume a lot of fluids, to frequently ambulate, okay, particularly airplane more than 6 or 8 hours. They bought stockings and they do leg exercise. It will decrease the risk. Actually, if you travel through British Airlines, they usually advise you, please do these things to prevent blood clot,
Indeed.
okay?
This is definitely true. They are showing you as to how it is that you can keep the blood properly circulating through your body. But so this was our discussion with Dr. Muhammad Al-Shaif, who's a consultant in internal medicine and as well as in coagulation of blood vessels at the King Fahd Medical City. And he's the head of the scientific committee of this particular conference, which is talking more about the deep vein thrombosis, and we discussed in today's edition of the program. If you have any questions from Dr. Muhammad, you could be sending those to us on goodmorningksa@gmail.com or through our social networking websites. With this, thank you very much,
Thank
Dr.
you very
Muhammad,
much.
for coming here. And should we say thank you to this?
Yes, it's a great
As
pleasure.
well.
Okay.
We hope that all of you were able to understand it a little bit more better, and hopefully we all can go through lifestyle modification and have more of an active lifestyle. Stay tuned to Good Morning KSA. Still, there's lots more to come.